Good afternoon, everyone. Thank you all for joining us today for another Cuyahoga County and Board of Health briefing. My name is Miranda Corton, and today we are joined by County Executive Armin Budish, Board of Health Commissioner Terry Allen, Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush, Board of Health Medical Director, Dr. Heidi Gullett, and Board of Health Co-Director of Prevention and Wellness, Ramona Brazil. Once the briefing is over, we will be taking questions from the media, but just a reminder to those who have joined by phone, the press who have joined by phone, to please keep your phones muted until after all our speakers have presented, and then we will go ahead and open it up for questions. We will start today with County Executive Armin Budish. Thank you.
Thank you. Hi, everyone. I appreciate the opportunity to give you all these regular briefings. Thank the Board of Health, particularly Director Terry Allen, Dr. Heidi Gullett, Ramona Brazil, and new to us these last couple of briefings, Director of Epidemiology, Jana Rush, for their hard work and their dedication, both to the health and safety of all of our county residents. You know, over the course of these past months, I've come before you to talk about how our residents and small businesses have been just terribly suffering. We've acted to protect the health of our residents by spending millions on testing and distributing millions of items of personal protective equipment. We've supported residents who were literally weeks from eviction. We've created a small business stabilization fund to save small businesses whose doors were closed for weeks. We've been taking urgent action to make sure our residents and businesses survive the pandemic and so that they can thrive when it's over. But there's one sector that we haven't really talked much about, and that's the arts, culture, and entertainment sector. This group of nonprofits, for-profit businesses, and artists together provides for Greater Cleveland more than $1.3 billion in economic impact. Yeah, you heard that right, 1.3 billion. It employs more than 10,000 people. Or I should say, used to employ, because once COVID hit, more than a third of these employees lost their jobs. That's the highest percentage drop in any industry for employment. And it's not over yet. This is going to be a long, hard winter for many of our most beloved artists and culture spaces. It's not just about the economic hit. Arts and culture is really the heart and soul of our region. Imagine a Cleveland without our world-class arts institutions, or your favorite music club that's just around the corner, or your favorite performance space, or the artists that are so important to the fabric of our lives. Probably every one of us has a favorite place to experience arts and culture. And most of these places are now either closed entirely or are having to operate at such a limited capacity that they actually lose money by opening their doors. We have to do something. We have to do something to save our arts and culture. Even though we're experiencing one of the grimmest times in our history, we must emerge with our region intact, and we must become even stronger. We must keep our sights set on what makes us so special as a community, and we must not lose our identity. That's why I've asked County Council President Dan Brady to sign off on an emergency request for $4 million in funds to support arts and culture organizations and individual artists who are harmed by the COVID-19 pandemic. The funds will be going to two separate arts organizations. One is the Arts and Culture organization called the CAC. They'll receive 2/3 of the funding to distribute to arts and culture nonprofits. And Arts Cleveland will receive the other 1/3 of the funding to support individual artists and for-profit creative businesses. How can you apply? The arts organizations have created a webpage where arts and culture organizations and individuals can go to apply or for more information. Go to arts-cares.com. That's arts-cares.com. A couple of things to note before folks go to the webpage. You or your organization must be able to show financial losses due to COVID-19, and your primary mission must be centered in the arts and culture sector. You'll also have to show that your losses have not been addressed through the Paycheck Protection Program or any other public health program. I'm pleased that our county is able to offer critical support to this incredibly important part of our cultural lives. All right, next. Seems like everything these days is urgent and important. While we have terrible economic and health hardships, we continue to wrestle both as a nation and as a community with the long-standing impacts of structural racism. I've spoken before about the two separate groups that the county administration and county council have created to address structural racism. There's an internal group that's focused on our internal processes and our internal culture, and making sure that we're able to track the impact of our programs. And then there's an external commission, the Citizens Advisory Council on Equity, which we call CASE. CASE is charged with identifying and eliminating structural racism in the general community. CASE is made up of 17 community leaders, each with a different experience, which should contribute to this effort. But we want more. We want a whole lot more, actually. We want to broaden our outreach to obtain input from the entire community. So starting next Friday, a week from today, the 23rd, we'll be hosting virtual community conversations on racism. These sessions will be conducted virtually over Zoom and powered by the Cleveland Foundation's Common Ground platform. We're hosting 3 conversations, which we hope will be joined by hundreds of participants. The sessions will be facilitated and captured by a scribe. CASE will then take all that information and they'll be able to use it to create their action plan. You can sign up to participate in one of the 3 sessions by going to the county's Fighting Racism page at cuyahogacounty.us/fightracism. This is an important opportunity to have many voices heard, and I encourage you to sign up. That brings me to another crucial way to have your voice heard: voting. I know I sound like a broken record, but I'm not going to stop talking about this until Election Day is over because it's just so important. You must get out and vote. There are 4 ways to do it. You can mail your ballot you can also drop your ballot at the Board of Elections early. You can go to vote in person at the Board of Elections early, or you can vote at your local polling place on Election Day. You can go to the Board of Elections website, 443vote.us, and see all your options. Pick one. I really don't care which one you pick, but make sure to vote. Meanwhile, I want to give everyone an update on the voting that's already happening. Cuyahoga County, like so many places across the country, is experiencing record-setting early participation. It's really amazing. Over 320,000 vote-by-mail applications have already been processed. Compare that to 189,000 in 2016 for the whole election period. Of those applications processed, almost 80,000 have been returned to the Board of Elections, which is more than double the number of ballots returned in the 2016 election at this stage. The Board of Elections is also seeing a real uptick in early in-person voting, which started October 6th. Already, more than 15,000 people have cast their votes early. That's compared to a little over 6,000 in 2016. That is some kind of increase. I spoke earlier with Board of Elections Director Anthony Perlotti, and he informs me that the early voting process is running quite smoothly. On average, they're processing 50 or 55 voters every 15 minutes. Once you enter the front doors of the Board of Elections, it takes about 15 to 20 minutes to complete the entire voting process, from check-in to scanning your ballot. It's really not a bad time period. Here's what you need to bring for early voting: a form of ID like a driver's license or a state ID. Or you can bring a utility bill showing your address as long as it's within the last 12 months. And please don't forget your face mask. We all need to help keep each other safe. Unfortunately, as we heard yesterday, our county, which has been doing so well, is now back in the red. I think you'll hear more about it from Terry Allen in a minute. I really beg each and every one of you to take responsibility for your own health and also for the health and safety of all of us. We have got to keep working to get control of this terrible disease. We can't become lax. Thank you very much.
Thank you, Armin, and thank you for that supporting message. You've been a public health champion throughout this pandemic response, and your continued support and collaboration across all the county agencies has been very welcome during the pandemic. Today, I'm joined, as Miranda mentioned, by Jana Rush, our Director of Epidemiology, Surveillance, and Informatics, Dr. Heidi Gullard, our Medical Director, and Ramona Brazil, our Co-Director of Prevention and Wellness. Yesterday, Governor DeWine made the announcement that Executive Budas just spoke to, that we've moved to risk level 3 public health emergency, or RED, in the public health advisory system, indicating a high degree of exposure and spread in the community. We've now met 5 of the 7 indicators for the advisory system, including the number of new cases per capita, a sustained increase in those new cases, the proportion of cases that are from non-congregate sites, that is out there in the general community, and a sustained increase in emergency department visits, and a sustained increase in outpatient visits. 5 of the 7, that's very concerning. We also know that to date, among hospitalized cases, that African Americans are over 3.5 times more likely to be hospitalized than their white counterparts. So the inequities that we've seen since the beginning of this pandemic continue. The governor also stated that in Cuyahoga County, we've had a significant increase in daily outpatient visits over the last 10 days, notably from an average of about 187 cases a day on October 1st to an average of 445 cases per day on the 11th of October. So yes, these trends are very concerning. Over the last 2 months, we've had a very high degree of masking in our community, which we've all been very proud of. People have been following the physical distancing guidelines. They've been implementing their remote work options where they can, promoting hand hygiene, and staying home when they're sick. And all these things have worked together to keep our case numbers down. The spike in cases now extends well beyond Cuyahoga County, as you've seen from the data at the state level, with a total of 29 counties at level 3 or red at this stage in the public health advisory system. And that represents 2/3 of the entire population of the state. This clearly demonstrates that, as we've said before, that infectious diseases don't pay attention to borders or recognize boundaries on maps. Additionally, the state COVID testing positivity rate has doubled since early September. And at the state level, we're currently at a 5.2% positivity rate. Our rates are climbing. You'll hear about that today in a bit in the briefing. With COVID fatigue clearly setting in, we're seeing people expanding their social circles and gathering in groups indoors. We know that maintaining your smaller bubbles of social interaction is good prevention, particularly in times like this, and it works. The increase in social mixing without masks, as people begin to move inside as the weather changes, can have a dramatic impact on the trajectory going forward. We are all working to prevent hospital surges and ultimately prevent fatalities in our community. We know people are tired of this virus. I'm tired of this virus. We need to stick with our prevention playbook and do our part to keep our community safe. Our continued vigilance is our way out of this pandemic as we wait to learn more about the timing and availability of a COVID vaccine here in the United States. With these new developments, we also know that our school districts have been closely monitoring the situation as they implement their plans. We just spoke with them this morning, and we speak with them, of course, on a regular basis. Several weeks ago, the Cuyahoga County Board of Health took a close look at the science and evidence and created guidance for schools to consider in their reopening plans. And currently, the guidance suggests that schools consider remote learning at level 3 or red in the state advisory system, with considerations for special education in a face-to-face way. We know that there's a price to pay for every difficult decision in this pandemic. We'll continue to engage with the school districts on a regular basis as they implement their plans, and we respect the decisions that they have to make on what's best for their communities, as they've done from the start in this pandemic response. So we'll continue to monitor the most current evidence and science, and we'll review our guidance as we go forward in the future. I wanted to take a moment to remind folks about local testing locations for COVID. There are now a wide range of places to get tested for COVID in the community. All the federally qualified health centers have testing available, and you can go to clevelandcovidservices.com. I'll repeat that, clevelandcovidservices.com. And there are no age restrictions, and you don't have to have symptoms to be tested. So this is a great new resource from our federally qualified health centers. The Metro Health Cuyahoga County Board of Health Community Testing Collaboration that's funded through Cuyahoga County with the support of Executive Budish will test age 10 and up, and you don't have to have symptoms, and the locations are noted on the community testing events are noted on the ccbh.net website, which you can see behind me. CVS offers testing, was moving to the pharmacies. CVS offers testing to people age 12 and over. Rite Aid and Walgreens provide testing for people age 18 and over. And you can go to their websites, the respective websites for these pharmacies, to learn about local locations and sign up. Any of the Ohio National Guard pop-up testing sites will test age 2 and over, unless otherwise specified. And those locations are available at coronavirus.ohio.gov. And if you're a patient, of course, at one of our hospital systems, you can contact your medical provider about testing options as well. So there's a wide range of places that you can be tested in the community. Changing gears, let's talk about flu for a minute. Since the onset of the influenza season, we've been encouraging everyone to roll up their sleeves and get their annual vaccination. And we've been holding points of dispensing flu vaccination clinics outdoors for over a month. The Board of Health has been recently holding drive-through clinics here at our offices every Wednesday from 9 to 11:30, and they'll take anyone that comes. You can also get a flu shot at our Warrensville Heights clinic by appointment, and we do that in order to maintain proper social distancing at those sites. As we said on many occasions, this is the year to get your flu shot. Pharmacies, hospitals, community clinics also have flu vaccine available, and you can go to fluvaccinefinder.org. I'll repeat that, fluvaccinefinder.org, to find options in your area. We don't care where you go, we just want you to get vaccinated. The Ohio Department of Health is also developing a media campaign for flu with more information forthcoming. So now is the time to reinvest in what's worked so well for us over the last 2 months in order to limit the pain and the heartbreak from this pandemic going forward, for the sake of our families, our friends, our co-workers, our neighbors, and many others in this community. It's also important to recognize that almost 16,800 people in Cuyahoga County are now presumed to have recovered from the virus, which is very encouraging. Wrapping up, I want to extend a big thank you to our phone bank staff, our case investigators, and contact tracers. Our phone bank staff have now fielded over 20,000 calls addressing testing, schools, complaints, long-term care, state orders, and a wide range of other community concerns, including personal protective equipment and quarantine and isolation. As you can imagine, the calls they receive can be challenging at times. Through it all, they've been incredibly patient, professional, and resilient. Our disease investigators have been equally impressive, having dealt with over 25,300 cases and close contacts since the onset of the pandemic. In their role, they're equal parts investigator, empathetic listener, service navigator, and counselor. All of our staff, like all of us, have been living through the challenges and anxiety of our times in their own lives. Through it all, they continue to give back to this community in extraordinary ways, and I'm eternally grateful for all of them. So, with great weather on tap for today and tomorrow, it's time to enjoy the fall foliage, get some fresh air, and stay safe. Thanks for your time and attention, and now I'll turn it over to Jana Rush.
Okay, thank you. Good afternoon, everyone. So I'll be covering our key metrics this week from our data brief. And so just to cover our cases, so we are currently over 13,000 cases have been reported to date here in the Cuyahoga County Board of Health jurisdiction. We've averaged 50 cases per day in September. And just as of last week, we are averaging currently 70 cases per day. So we are starting to see an increase in our case volume in comparison to where we were seeing our numbers back in August after that decline in September. We'll have a better sense of this as the month goes on how those cases will average over the course of this month. For our fatalities, sadly, 4.5% of our cases have resulted in death. This has been stable during the month of October, and we have not had a change from the previous week in the number of fatalities. For hospitalizations, about 10% of our cases have resulted in hospitalization, and that has also been stable for the month of October. For our demographics, our case demographics, so for our sex, age range, and race, the percentage of cases remains stable in these categories. The number of healthcare workers has increased slightly from what we saw last week. So currently a quarter of our cases are healthcare workers. So that's up 2% from where it was last week. And we're currently at 25% of our cases are healthcare workers. So we can continue on to our EpiCurve. So our EpiCurve really is showing the distribution of the cases that have been reported to us by illness onset. And as you can see, that spike, it still continues to be the highest number of cases we've had to date was in July, but we are currently increasing in the number of cases that we're receiving currently. And for our zip code map, so this includes all of our cases for all of Cuyahoga County, including Cleveland, Ohio. And a takeaway from here is that approximately a third of the zip codes in Cuyahoga County currently have over 500 cases associated with those zip codes. Again, this map has been pretty stable over the past month. And so if we can go on to our hospital bed capacity, the percentage of adult medical beds and our critical care beds being utilized has been fairly stable at approximately 80% this month. Our ventilator usage has been also stable at about 40% usage this month. As far as our testing rates, for our hospital testing, the number of positive results has began to increase. So for the month of September, we had 2.5% positivity rate, and currently this week We have increased to about 4% this month in the number of positive tests through our hospital systems. We've also seen a slight increase in our nursing home positive tests. That has increased from 2.4% to 2.7%. Another thing that I'll add here is that our flu data is currently posted on our website. Currently to date, we have had minimal activity with flu. There have been no hospitalizations or deaths associated with flu to date. And our ER visits has been approximately 2% in relation to flu activity. And so what I like to end with is that I like to put our data into perspective and what does this mean for us going forward. So currently COVID-19 activity is increasing in the Cuyahoga County jurisdiction. Our small actions that we're taking every day do make a big difference. It makes a difference in the lives of our loved ones, in our community, and ourselves. So therefore, we can and we must continue to do our part with wearing our masks, keeping our distance, and avoiding gathering in groups of any size. We all have worked hard to adapt to keep our friends, family, and community safe. So let's keep it up. And we have a long road ahead as we head into the fall. Thank you. And now I will turn it over to Dr. Gullett, who will discuss more information about our community testing.
Thank you very much, Jana and Terry. So I want to spend a few minutes talking to you today about the importance of testing. We have worked really hard over the last 7 months with a lot of partners in the community, and particularly our hospital partners, to create an opportunity for testing availability. So it's really important, as we see cases increasing, that testing happens and it happens regularly. If you are a contact of a case, even if you don't have symptoms, you should seek testing within the incubation period of COVID-19, which is 2 to 14 days after you were exposed. It's really important that people understand the value of testing if you've been exposed. Additionally, if you have any symptoms of COVID-19, it's also critically important that you seek testing, whether or not you know specifically that you have been exposed to someone else with the infection. We are all susceptible or at risk for this infection, all of us. It's very important that all of us understand how valuable testing is as we head into these winter months. We also really want to make sure you know that if you go for a COVID-19 test, please stay home. Please stay within your home until you receive the result. We do have people who get tested, think that they may have it, yet still go out and do all of their activities. And that creates a real problem for spread and a real problem for contact tracing. So we want you to test. We want to test often. We want to test all over our community, and we want you to stay home while you're waiting for those results. As Terry pointed out, we have several locations throughout our community that also offer walk-up testing, so you don't always have to stay in a vehicle. You can find those locations, again, at clevelandcovidservices.com or ccbh.net, or you can look up the pharmacies or your healthcare provider in our community for more information. All of this in the entire COVID response from the beginning is about two main things. One is we want to prevent overwhelming our hospitals so that those who are sickest from this infection can get the care they need when they need it. If our hospitals become overwhelmed, it becomes very hard for the hospitals to provide high-level care to everyone who needs it. So the testing approach I just described and all of the work you heard and you've heard us talk about for months with case interviews, contact tracing, isolation, and quarantine is about reducing the risk of spread of COVID-19. Furthermore, the bigger picture here is that we are trying with all that we have to reduce further loss of life from COVID-19. Dr. Frieden, the former CDC director, yesterday tweeted out, "One death is a tragedy." And that's absolutely true. But in our community, we mourn the 671 people who have died from COVID-19, along with the 5,054 Ohioans who have died from this disease. We cannot have any more preventable deaths. So it is incumbent upon all of us to do the one simple thing every one of us is capable of doing, and that is wearing a mask. We can all do it, and you may be the one saving a life, your friend, your family member, or a stranger. But it's really, really important that we all know we are part of this solution here. Next, I want to talk a little bit about flu vaccinations. You heard Terry talk about flu vaccines. You can find places to get a vaccination, not just flu, but other kinds of vaccines at vaccinefinder.org. But we're particularly important for everyone to think about getting their flu vaccine this year. I got mine, my entire family got theirs. It's critically important this year. We know data from the other part of the world that's already been through their flu season is that they significantly reduced the number of people who got the infection and died from influenza by getting vaccines broadly, significantly increasing the number of people who got them, and also in addition to that, masking and doing social distancing. So this year, if you get influenza, it's a problem, but if you get influenza and COVID-19, it's a much bigger problem. So it's critically important we do all we can. And vaccination is a safe and important part of that. I also wanted to talk for just a moment as we enter this colder weather. Since we had our last press conference 2 weeks ago, it has gotten a little bit more crisp, beautiful fall air and foliage, but a little colder. That means people are inside more. And it also means we start seeing other infections that are seasonal, like influenza, but also like RSV, other run-of-the-mill viruses that cause the common cold, and other infections like norovirus. All of those we see seasonally, but the risk this year is that all of them have symptoms similar to COVID-19. So it's complicated this year to sort out whether you have a simple viral infection from something that's benign, or whether you may have COVID-19 if any of these symptoms develop. So we're working closely, as Terry talked about, with our school district partners, as well as our clinical partners, to help sort out what kind of infections may be causing symptoms that people see through testing, and also through lots of data and evidence about when it's safe to return to school or work after you develop symptoms. And again, testing is critical here. Finally, I'd like to move on to something that I think is really important. Terry mentioned it a little bit, but we have had a number of reports throughout the pandemic, but also more recently, of people being bullied or stigmatized because they or someone in their family has COVID-19. We are all in this together. We are all at risk. And this is a community where we need to respect, love, and provide privacy to those who have been affected by this infection. There are thousands of families in Cuyahoga County who have had the infection or been affected by it or lost loved ones. And it's critically important that we do everything we can to support them. Social media has been particularly challenging during this time, with quite a bit of stigma and bullying that's happening around people who are COVID-19 positive. So I would just ask, please be respectful. Please protect others' privacy. And please be kind. This is a tough time for all of us. But any one of us could be that person who has COVID-19. So we really need to come together and be at our best in order to get through this as a community. Lastly, in my moment of gratitude, I would like to thank our communications team. Reflecting on the many times that I have brought up different individuals or groups who have been remarkable during this response. I think I have been remiss in not recognizing our amazing communications team here at the Cuyahoga County Board of Health, led by Kevin Brennan, but including many other people that work behind the scenes. They make sure messaging is appropriate, that it reaches people with different languages in different locations and through different mechanisms like social media, radio, TV, and the internet. We thank you all so much for what you do. You've taught all of us how to communicate better, and we're very grateful for all of the ways that you've served our community throughout this pandemic response. With that, I'll turn it over to my colleague, Ramona.
Hi, everyone. First, I would like to just kind of echo some sentiments and share some gratitude for our Board of Health staff in response to the surge in cases that we've received over the last week. We've added more staff on evening and weekend shifts and increased our daily staffing from 12 to 15 people a day to 25 to 29 people per day to perform case investigation and contact tracing. We have also experienced an increased volume in calls and complaints, and we have worked to have our call center fully staffed to respond to public inquiries. I want to personally thank Becky Burke, who does all of our scheduling, for her work over the last day to help with finding additional staff to fill those spaces. Our staff balances our own personal and family needs and also answers the call to meet the needs of our community. We are tired, I think that's been expressed, but we believe in the mission and the duty of public health to minimize the spread of COVID-19. As Jenna expressed through our epi brief, we have seen a large increase in the number of cases over the last week. And yesterday alone, we received more than 90 cases. That's the highest number we've received in a while. We are concerned about the direction that we are going in and also the steepness of that increase. We have not seen any large outbreaks that would account alone for this increase in cases. It is the small collective things that we do together that will decide the direction that our community goes in over the next week and 2 weeks. We really do need to refocus and button down the hatches again so we can start to see a decline in the number of cases that we're seeing. We continue to see transmission among families and friends through social interactions like parties and weddings and funerals. It's the same story. It just keeps continuing and we're just seeing more of it, but not anything special or in particular. When we contact cases, we are also finding that they have more known exposures than at the beginning of this response. So when we used to call maybe in May or April, people didn't know how they were exposed. They generally were surprised to find out that they had a positive result. Now we're finding people who have a family member that's been exposed or a coworker or a friend. So generally we see that there's more spread in the community and people are aware of it. We are also finding additional sick people in the home when we call, such as children or spouses and such. And just to echo what Heidi discussed, I also personally would like to ask us to continue to show kindness to one another. More people have either had COVID-19 in our community or know someone who has. And while almost 90% of those people in our community have recovered, some people have had close family members become very sick and die from it. I spoke with someone recently who said she felt like she had a scarlet C on her chest. She had also recently lost a family member from COVID as well. She was unable to be with him, before he died. So people often are recuperating or grieving in silence because of the stigma that is being placed on them. And unfortunately, the response to COVID-19 has become very polarizing, but we need to remember the people who have been personally affected by this, and they need our community's support. Lastly, I would like to echo the support for voting. We have worked with the Board of Elections to provide guidance for safer voting. If you do choose to vote in person, please, number one, be patient. We've seen some of those lines. Remember your mask and maintain social distancing while doing so, and use good hand hygiene. And with that, I'll turn it back over to Miranda. Thank you.
Anna, we will now open it up for questions. So if you have a question, please unmute yourself and state your name, and then go ahead with your question. Thank you.
I don't know if you can hear me. This is Dave Nuthers with Fox 8. Hello.
Hello, yes, hi.
So I wanted to return to the discussion about schools. Terry Allen, you mentioned earlier that there was some advice given to schools. I know that superintendents spoke in a virtual conversation with the health department earlier today. I'd just like you to tell us more about the advice that you're giving to schools and your thoughts about some schools now that are continuing in the county to operate in person, others that still have hybrid. Go ahead.
Yeah, thank you. So if we go back, I mean, really, I want to first say that if we go back to even graduation, which seems like an eternity ago, we've been interfacing with schools on a weekly basis, almost continuously, and in between. So it's a great partnership with the districts. We talk to public schools, private schools, charter schools, where we want to do what we can to help them to support the students and their staff, faculty. And so it's a great partnership, and we're grateful for that. It's a great way for us to exchange ideas and information. We also know that each district is different, and the resources that are available in each district may vary. And so those resources have a direct impact on the ability of any district to decide how best to engage their students. I said earlier, that there is a price to pay for any choice that we make. Long-term care facilities are thinking about whether they want to let family members come and visit the residents. They're worried about the safety of the other residents and, frankly, the resident that the family members want to come and see, staff, etc. At the same time, they know that there's a lot of pain and concern and heartache about not seeing family members. So this is a tough decision. And frankly, there's really no easy one answer in that circumstance. Similarly, as we think about schools, they're trying to make decisions about how to best engage their students. And we know that remote learning also exacts a price on students. The special education students need face-to-face support in particular. And so we understand those things. So what we try to do is to provide guidance based on the science and the information that we have currently. We're certainly encouraged in the near term that we've seen the number of the data that's posted on the state website, the number of school cases have not been huge so far. We have seen transmission in the schools. We've seen transmission in extracurricular sports and related events, and we're monitoring that. But we want to use the basic science available, what's most current, the guidance to make decisions and give advice. So we ask schools to consider our guidance. But we equally recognize that they've got to make choices based on what the will is of their district and their boards. And so we respect that in the way that we respect decisions that lots of facilities are making and agencies are making in the context of this, very difficult pandemic. So what we do each week is we talk with them. We hear about the concerns that they have. We've offered training on a range of topics, including contact tracing, case investigation. We've offered training on environmental related issues around safety, food safety in the school environment, for instance. We've put together some decision trees based on their request to help them understand how to help us with contact tracing. And what they do often is give us feedback on the tools that we create so that we can make more improvements, certainly along the way. So where we're at now with the guidance, they understand where we're at. They, of course, are in different stages. Some are remote, some are hybrid, some are face-to-face, and that continuum hasn't been much different since the beginning of the school year. So I think they're now taking the information we provided to make decisions that fit best with their district. And we're going to continue to monitor the science and the evidence relative to guidance that we'll provide. So that was the basis for our discussion.
Hey, this is Amanda Van Allen from News 5. I just want to follow up on that question. So your recommendation was that the districts go remote. That's what you said earlier. Is that correct?
Yes, that guidance was actually, yes, the guidance was put together several weeks ago now, and it's been made available to the district. We work with some supportive researchers at Case Western that helped us to really comb the evidence. And that was our guidance that we developed with the information that we had. And so we continue to look at the evidence and the science. We are encouraged in the near term, as I mentioned, that we are seeing a lower number of cases in the schools, and that's good. That's encouraging, but we need to follow the science. We are seeing cases in schools and other related activities, but our current guidelines stand. And as we have now, if you look back, it's really since August, we've made revisions where appropriate based on the most current information. And we'll continue to do that going forward as we have new information.
Thank you, Terry. Are there any other questions? Okay, thank you all. That concludes our briefing for today. So thank you again, and have a great weekend.
Thank you.
Thank you.